Hi, my name's Marissa. I'm going to be your student nurse today.
Hello.
Just going to put on some gloves really quick. Alright, and can you give me your full name?
Samantha Hall.
Okay, your date of birth?
June 16th, 1998.
And your medical records number?
12345.
Alright, it matches on the chart. I'm going to go ahead and check your bracelet. And it matches on the bracelet as well. Do you have any allergies to medication?
No.
Food?
Nope.
Latex?
Mm-mm.
Tape?
No.
The environment?
Nope.
Okay, perfect. So we're going to go over your vitals. Your blood pressure was 120/80. Heart rate was 68 beats per minute. Respiratory rate was 15 breaths per minute. Oxygen saturation is 99. And your temperature is 98.7. And those all came back normal. Okay, and you came in for pain today?
Yes.
When did it start?
About last week.
Okay, and where is it located?
In my head.
Okay, how long does it usually last?
It's a pretty constant pain. It gets really bad for about an hour or two a day.
Okay, and how would you describe the pain? Dull, sharp?
Dull, mostly.
Okay, and is there anything that makes it worse that you do?
Light, if I'm like watching TV or if it's in a bright room.
Okay, anything that makes it better?
When I'm in a dark room and I have my eyes closed.
All right, and have you tried any treatments for it? Any medicines?
Just ibuprofen.
Okay, and how would you rate the pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
When it's at its worst, I'd probably say it's a 7, but it's probably constantly a 2.
Okay, and so you did give me your full name and date of birth. Do you know where you are right now?
Hospital.
Okay, and do you know around what time of day it is? Breakfast, lunch, or dinner?
Lunch.
And do you know today's date?
June 4th.
Okay, so patient is showing no signs of distress, and she is oriented to self and location and time. So next, I'm going to go ahead and check your equipment. I see you have oxygen on. Is this comfortable for you?
Mm-hmm.
Okay, I'm going to go ahead and check behind your ears. And there's no erythema or lesions. That looks healthy. I'm going to check the tubing, make sure there's no kinks. There isn't. I'm also going to check to make sure that the oxygen matches the chart, and it does with 2 liters. Next, I'm going to check your IV. Do you feel any pain?
No.
Okay, there's no redness, irritation, or erythema. Again, I'm going to check the line, make sure there's no kinks, and that the saline solution does match what's on the chart, and it does. She does not have a urinary catheter, but if she did, I would check to make sure that there was no kinks in the lining, as well as making sure that there was no irritation to the skin and that the bag was not full. After that, I'm going to check your hair. So hair looks healthy and kempt. Scalp looks healthy, no erythema, irritation, or lesions. Next, I'm going to check your skin. Skin is warm to the touch. It is dry. There is no edema present, also no erythema or irritation. Looking at the arms. Again, no edema, erythema, or irritation. Skin is warm and dry. Next, I'm going to go ahead and check your nails. Capillary refill in both hands is normal, being less than 3 seconds. So I'm going to go ahead and check her feet. And again, capillary refill is normal, being less than 3 seconds. Next, I'm going to check your eyes. Lost my pen. All right, go ahead and follow my pen. Perfect. And if you could go like this with your hand for a second, I'm going to check your pupils. Okay, perfect. So you can remove your hand. Your pupils are round, reactive, equal, and reactive to light and accommodation, as well as her eye movement being bilaterally equal. Her sclera is white and healthy, and her conjunctiva is pink and moist. So after that, I'm going to check your ears. Membranes look healthy, as well as there being no lesions, irritation, or erythema. Next, I'm going to check your nose. Again, membranes look pink and moist and healthy with no drainage or irritation. Can you go ahead and open your mouth for me? And membranes look pink, moist, and healthy, and uvula is down the midline. Next, I'm going to check your breathing. Your breathing looks normal with no signs of muscle distress. Next, I'm going to check on your back. I'm going to be using the Greek pattern. You just turn a little bit. Okay, and anytime you feel my stethoscope on your back, go ahead and take a deep breath in and a deep breath out. And one more. Okay, breathing sounds clear and equal on both sides, and before doing that, I did sterilize my stethoscope. And we don't have an incentive spirometer, but if I did, I would teach her how to use it and then make sure that the patient did it correctly.